This is a prime destination for health and wellness exploration. This is where we deep dive into crucial health topics with insights from leading experts in the field. This is all about health. Hello and welcome to All About Health by AYOO. Live your best life. With me is Dr. Aditi. She's a senior consultant psychiatrist at AYOO. She has done her MBBS from LTM Medical College, Mumbai, and she has done her MD in psychiatry in NIMHANS, Bangalore. She has over a decade of experience in psychiatry, and today we are going to talk about depression. Dr. Aditi is going to throw some light on what is depression, what are the kinds of depression, what is the population of depression, and different touch points on depression. Dr. Aditi, welcome. It's nice to have you here.
Thank you, Akshay. It's nice to be here.
What is depression? Because oftentimes we hear the term depression being used in place of sadness or feeling bored.
Okay. So depression essentially is a mental health condition. It is a disorder, which means it comes with a whole set of symptoms that constitute the disorder. The most commonly understood part of depression is sad mood or low mood. But depression is a lot more than that. It's more than just an unpleasant mood state, which persists for over 2 weeks in general. So beyond that, a person can have so many other associated symptoms, namely, the first few things would be changes in their sleep patterns, changes in their appetite. It could increase, it could decrease. There would be a loss of energy, mental as well as physical. There's a loss of interest in things that they used to enjoy doing before. Along with all of this, the individual may have changes in the nature of their thoughts in general. Their thoughts tend to become more negative. So when they look at the world, maybe they find the world to be a slightly difficult place to deal with. Maybe they feel helpless. Maybe they feel a little hopeless about their life, that, things may not work out. Whatever are the challenges on my plate right now, I'm not sure if I can deal with them. And when that feeling of hopelessness worsens, it can sometimes push people into an intense state of despair where they feel like maybe life is just not worth living anymore. Those are just some of the symptoms of depression.
So, assuming a situation where somebody is in grief, how do we kind of differentiate depression and that state of grief? Because the entire some of symptoms that you just mentioned, so they're all similar during the time of grief also.
It's very normal for grief to last at least a couple of weeks to sometimes a couple of months. Everybody takes their individual, time frame, whatever it is they need to get over it. Even grief is considered to be a normal process. So beyond a certain time frame, generally it's about roughly 6 months. If somebody is continuing to be grieving so badly that it's impacting their life in general, how they function as an individual, then perhaps we consider that this is a little more complicated than just, a simple picture of grief. Maybe they are depressed, maybe they need a little more intervention, a little more help. But other than that, grieving is a very, very natural process. It's actually essential to process a loss in order to move on. So while the symptoms may sound similar, we take the context into account as well.
A regular usage of the term depression, just in different contexts. Like, for example, I'm feeling depressed today to go to work.
That happens. I think we all do it on some level. But it's important to be able to rightly label what you're feeling, what you're experiencing, in order to get the right kind of help in case one needs it. Also, my concern is that if we call everything depression, it's not just that we are not able to identify our own experiences. The overusage also sometimes keeps people who genuinely are experiencing depression from seeking help, because it's like, hey, everybody goes through a phase like that. You know, my friend also said they were depressed, but they are doing just fine. They go to work, they meet their friends, and yeah, there are phases when they are not doing so well. They take a bit of support and they are fine. So why do I need to consult a mental health professional? So we are not helping ourselves by mislabeling things. We are not helping other people get the necessary help if we continue with that kind of trend.
So imagine somebody is going through a particular such kind of a phase, and normally in the circle of the family or in the circle of friends, we tend to be gentle to them and then say, hey, don't worry, it's just a matter of time. So when is that threshold?
So the first thing to go for a toss in any sort of mental health issue is our sleep. Your sleep is disturbed, perhaps there's something on your mind. It could be simple, ordinary day-to-day stress. And it could also be something bigger than that, much more serious. So if it's something that's impacting your sleep, your appetite, your libido, if it's something beyond biological functioning, it's impacting your social life. So people with depression might tend to withdraw. They don't have the energy in them to want to socialize. They don't want to see people. They don't want to speak to them. It seems to be too tedious, takes too much energy. So it's impacting their social life. It's impacting their work life, their education. You can't focus anymore. You can't concentrate. You're either like constantly in the middle of negative thought processes, and it makes it difficult to focus, or it's just simply that your attention wavers. So when you reach a point where you feel like these experiences are actually taking a toll on your normal day-to-day life and functioning, perhaps it's a good idea to meet somebody.
Is there a way out for themselves to try and cope up with things?
Some people cope by physical activity or by talking to other people, sharing with them, people who generate better solutions for them. Some people cope by journaling or things like that, just to get it out on paper or in a voice note, whatever it is that's going on in their mind. But these measures only help to a certain extent when we talk about stress being a factor that can lead to depression, right? So if you're stressed, it's perhaps going to be for a couple of days, maybe a week, 10 days. But if it's persisting and these symptoms are coming into play, and it's been going on for long enough, perhaps you're making that, perhaps depression is evolving slowly. And then your functioning starts getting compromised. And it's not like you suddenly go from being stressed or being well to, deeply, severely depressed or feeling like life is not worth living anymore. So even in the initial stages of depression, where it's mild, added measures of lifestyle change, exercise, finding different ways of coping, handling stress can help as an add-on. Right. But that's perhaps a point where I would say take treatment, because just simple non-pharmacological, non-therapeutic measures will not be sufficient. You would want something that's addressing your symptoms and not just the cause of it.
Dr. Aditi, what could be the possible causes of depression?
Okay. There are a number of factors which can lead to depression. Let's start with the biological factors first, and then we can go to, things in your environment and the stresses.
Yeah, that was going to be my next question, whether it is biological or depression or anxiety or any kind of mental illness, it is just restricted to mind and nothing to do with the body.
That is the general notion, right? And we are trying to challenge that it's just like any other physical illness. If I'm to make the distinction that way, mental health conditions are also rooted in changes in your body and brain's biology. It's not just something that's happening in the ether.
So then why is it called mental illness? Why not physical illness and a part of physical illness?
Well, that's a distinction that has been made over the ages, so I'm not sure how to answer that. That's just, it's easy for people to understand that distinction, but it's really not that simple. Your mind and your body, or your brain and your body, are constantly communicating, and there are changes. Just to give a simple example, when you have fever, if you've had fever for 2 days, you've been sick, how does your mind feel? A little tired, foggy. You find it a little difficult to concentrate. So it's like your body is sick and your mind is affected as well. On the other hand, when we are anxious, so anxiety is in the mind, right? But people have racing heartbeat. They have shaking of hands. They have sweating, right? Why is that happening to your body if it's all in the mind? That's because there is a constant communication. It's not something that's happening in isolation. The first thing is that there can be a genetic underpinning to depression, which means the tendency or the vulnerability to develop depression can be passed down the families. So I say vulnerability. That doesn't mean it's 100% certain that if a family member has depression, that this individual would also 100% develop depression. It's just that there is a vulnerability. With the right kind of mix of adverse circumstances, they are at risk. That is all. So in terms of genetics, individuals can be vulnerable to developing depression. And it also depends on what kind of relation you have with the individual. Is it a parent or sibling? Is it a more distant relative? So the risk is much more when it's your first degree relative. It's somebody from your immediate family. Beyond that, there are biological changes that happen in an individual's brain as well as the entire body in response to stress, which can lead to the picture of depression. There are changes in neurohormones and chemicals that lead to signaling in all your brain circuits. When these chemicals behave differently compared to the norm, it can lead to a state of depression. It's actually a lot more complex than that, but for the sake of simplicity, let's just say that we know that there are changes in how your brain signals the chemicals that lead to that. There are also changes in certain areas of brain in individuals who are depressed. So these areas may show loss of neurons, which means they become smaller. Neurons essentially are the cells that make up your brain. So which means your brain is actually losing those cells when an individual is depressed. There is a brain area called hippocampus, which stores our memories. And that area is seen to be smaller in individuals with depression as compared to the average person. Apart from that, essentially, there is a very heightened stress response in your body during depression. So there's a lot of circulating cortisol, which is our hormone that our bodies produced in response to stress, and that leads to multiple changes in the body. Just to lay a framework for the idea that depression is very, very biological. It's not just something that's in the mind. Right. That brings me to another change that we observe in depression. A lot of inflammation is seen in the body. Inflammation, changes in markers that herald inflammation in our body is seen with depression. Just again to lay the groundwork for biology. Moving on, there are so many environmental factors that can lead to depression, starting from, individuals.
Childhood trauma?
Absolutely. Trauma or just the experience of childhood adversity of any kind. It could be financial hardships, loss of a parent, any other kind. So when we say trauma, we have a very specific set of events in mind that are traumatic. But any sort of childhood adversity can lay some sort of groundwork for depression again. Childhood trauma in that way is experience of abuse, even experience of neglect for a child. And they are just left to their own device with nobody really being around to take care of them. That itself can be a risk factor for developing depression.
Right.
Any sort of adversity which can overpower our resources for coping can sometimes precipitate depression. So it's like a double hit sometimes for people. Individuals who are genetically, biologically vulnerable, and then there is a hit from outside. And that sort of,
doubles up the entire situation. Are there stages of depression?
Like we were talking earlier, there's always a spectrum on which symptoms develop. So there's somebody who's just stressed. You can still cope with it or not, depending on what is available to you. Then symptoms start developing. They could still be subclinical, which means though you may be feeling, you may be experiencing a low mood, lack of energy, lack of interest, negative thoughts, your functioning has not taken a hit yet. So it's still subclinical. And then once functioning takes a hit, which is when we cross into the threshold of clinical depression. That's when it's a good idea to seek help. It's not just going to bounce back by itself generally. And then the more we leave it untreated, the more severe it can become. So when it comes to mild depression, sometimes, not always, we can try to manage it with psychotherapy and lifestyle changes. But when we are in moderate, it's absolutely a given that we have to give medications as well. And then it can become really severe. And what severe means is individuals having, remember those thoughts I told you about in depression?
Yes.
So the feeling of hopelessness or helplessness becomes so intense that people might feel like, life is not worth living anymore. I wish I didn't wake up tomorrow. I wish I didn't have to face another day. That can graduate to a stage where people start having suicidal thoughts, which is, let me just do something to end my life.
So how do you tackle a situation as a family or as a friend when an individual going through depression is not really willing to seek professional help and instead would choose to have a certain set of coping mechanism for themselves, or is stuck in a certain social stigma?
So countering stigma on a larger scale in society is perhaps a bigger discussion. But when we talk about the people in our lives who are struggling, who need help but are not able to owing to stigma, essentially stigma is about perceptions, right? So if you find somebody struggling but not able to seek help because of stigma, the best thing to do perhaps would be to show them support and understanding and facilitate help seeking for them. Because this is an individual who's afraid of how people would see them, what they would think of them if they came out with the fact that they are depressed. Can you make it a little easier for them to seek help by showing that you do understand, you are aware, and you would love to help in any way you can? Simple things.
Have you ever come across cases where in spite of providing information and being gentle and all of that, the individual is still not ready to seek help? Can we call that a point of no return?
Well, when it comes to treatment of depression, the only point of no return would be a completed suicide. But other than that, it's absolutely possible to address it at any stage. If somebody is not ready, we try to talk to them, try to convince them, present them with facts. Also make them realize they are not alone. About 1 in 20 individuals you meet would be undergoing depression, at least. It's not possible for most adults to have gone through life but not having seen somebody they know struggling with it. It's just that we choose not to talk about it. Sometimes we ourselves are uncomfortable to talk about it, so we don't offer assistance to another person, right? So we take some time, if the individual needs time, to come around to the idea that help is available and they could seek it. It's about trying to convince them.
Okay. So what are the different kinds of treatments available for depression?
So in mental health, we have a two-pronged approach, or two kinds of treatments available for most conditions. One is medications or pharmacotherapy. The other is psychotherapy, which is a talk or conversation-based approach to addressing symptoms. It's a little different than how people understand counseling or lay counseling, which is more like an individual sitting, listening empathically, providing you, a sounding board of sorts, or helping you solve your problems. This is more of a treatment-oriented approach, where the symptoms are in focus, and we have to come up with strategies to address them. Okay. Beyond that, obviously, add-on measures like lifestyle changes, definitely, as and when the individual is in a position to initiate them. We've already discussed these. There are other treatments which are not used in all cases. They are reserved for specific circumstances. There are methods of brain stimulation. I will not go into details, but there are methods like transcranial magnetic stimulation or electroconvulsive therapy, which is reserved for severe situations like somebody being suicidal but has great effects in that particular circumstance.
So you spoke about medication. Are these medicines addictive?
So that is a very common misperception that keeps people from taking the treatment needed. That is not the case. There are certain very specific kind of medications which can be addictive if taken by yourself without supervision. And those are not antidepressants, different kinds of medications that are given as add-ons. Antidepressants are not addictive. A lot of people also have the notion that once I start treatment, I will have to be on it lifelong. There is no one-size-fits-all here. Treatment is customized to the individual's history, their experience, and their specific needs. But the only thing we say is, once you're on antidepressants, it has to be taken regularly. It cannot be that, like painkillers, today I have pain or I'm not feeling good, let me take it today, let me not take it tomorrow. They are taken consistently. But when it is time to reduce their dose or take them off, we do it in a very, very specific fashion. It's not something that you should just stop by yourself. But they are not addictive. Let me say this again.
So how do you measure that a person is completely out of depression?
So we track a person's progress based on our own examination. Unlike most of your physical health, I don't have blood tests which tell me a person's depression is better, right? So it really depends on my own examination, my own interviews with them, where I'm assessing how they are doing. But again, so the treatment of mental health conditions is a little different than physical health conditions. It's not like, okay, my fever is gone, so I can stop paracetamol. Even though one may be feeling better after taking medications, that doesn't mean all the changes that have happened in your brain, to your brain chemistry, have gone back. They are just better now because you're on medications. Those changes take time to subside, which is why the treatment of most mental health conditions is a little more prolonged. That is all. So you should not stop medications by yourself because you're feeling better. That's one more challenge we face.
So which is that point where, you can say, okay, you can stop medication or you're fine now. Which is that point?
Like I said, perhaps leave it to your mental health practitioner to decide upon that point. It's different for every individual based on their history, how many episodes they've had, how prolonged or severe was this episode that you're on treatment for, things like that.
Okay. So when you mention previous history, one question comes to my mind. So if a person is 100% okay from an episode of depression, is there a point in that person's life where he can again encounter depression?
Sometimes. So if you remember, I spoke about vulnerability, right? So sometimes there can be a vulnerability to develop episodes. And like we discussed, the second hit can come from outside. So sometimes you are in tricky circumstances. They take a toll on your brain's functioning. One can be pushed into depression. And for individuals with vulnerability, it can happen more than once also. It's entirely possible. Which is why I'll again have to insist, proper treatment under the supervision of your mental health practitioner. Go by their advice. That is why we tailor make treatments to an individual's needs. Sometimes we would say medications and psychotherapy to address this vulnerability. Can we change some thought patterns that kind of push an individual into stressful states again and again? So it's tailor-made for everybody depending on their requirement, but it's entirely possible for an individual to have recurrent episodes of depression.
Have you heard of anybody saying that, okay, this person went through so-and-so, so-and-so, so-and-so stages, which resonates to all the symptoms and all the causes and effects of depression. However, that person has managed to heal himself. I am just questioning this more like a possibility. Is there a possibility like that?
These changes that are set in your brain in motion can sometimes remit by themselves, but then we are talking about a span of months to a year or more, and that is a period of intense suffering for an individual. It could just be that the processes have reverted back to a state of near normalcy after that.
Okay, so what are the different age groups, and will depression vary from gender to gender?
There's a slightly higher prevalence in women, and people aged 15 to 49 years usually have a higher prevalence. Now, when we talk about these populations, what we talked about as the symptoms of depression, usually adults have those presentations, but it's a little different in elderly, it's a little different in adolescents, school-going children, things like that. So when we talk about elderly, they have sometimes a little bit of difficulty in recognizing or acknowledging that flat or low mood itself. The elderly sometimes find it difficult to just acknowledge that they are feeling this way. So their depression sometimes presents a lot more as anxiety symptoms. They are very restless, they are agitated, they are anxious about every small thing. They could be pacing around the house. And elderly can also develop anxiety about, falls and things like that. So they keep wondering about that, limiting their life, stop talking to everybody, not eating properly, not taking care of themselves, not taking medications on time, things like that. But they might not come out and say, hey, I'm feeling like this. So it's a little tricky to sometimes get them to treatment because they also have notions like, my life is almost over. Why waste so much time and effort on me? It's okay, whatever happens. Sometimes you have to counter these ideas and say, no, you need treatment. Because it's all, at the end of the day, it's all about quality of life, right? You're suffering. Your life is not the same as before. In adolescents, depression may present again as a lot of irritability rather than sadness. They might become really angry and irritable, much more than, whatever their usual baseline is. They might become very withdrawn, not talking to family members, not meeting friends. Sometimes they overindulge in gaming, net surfing, content, etc., just to kind of cope with the negative feelings inside them. So we see these as discrete problem behaviors. Oh, the child is really ill-behaved and, they back answer. They are so angry all the time. They are gaming all the time. But we fail to recognize that there might be something underlying it.
We find alternatives, maybe smoking, maybe drinking, maybe drugs, any of those things, just to suppress what we are feeling. So what could possibly be appropriate coping mechanisms?
That's a very wide topic, Akshay. But when you talk about specific coping mechanisms like substances, alcohol, cigarettes, or other substances, things like that, sometimes maybe, these things work in the short term. If you're dealing with something, it helps you either forget it, numb it out, or distract yourself. The same actually goes for, overdoing social media, content surfing, because it helps us not have to think about whatever it is that's actually weighing us down. But in the end, how long do you think it's sustainable? Is it
It is
really
not.
helping, or is it going to end up harming you? Because if you overdo substances, you'll probably end up being dependent on them. There are always chances of that. Or it could just physically do you a lot of harm. Other than that, it's actually taking you away from gainful reality, for one, gainful productive activities which can actually boost your self-esteem and help alleviate negative mood for others. And so we have to actually take a step back, look at how we cope. Is it working for us? Maybe it worked for us in the past. Maybe it worked for us for some time. But do you see it working for you a year, 2 years down the line? Or you want to have a more sustainable way of coping in terms of lifestyle changes? It's something we can always look at. Take a hard look at that and see what changes need to be made. And if you want to discuss it with somebody, you could always visit a professional who could help you pinpoint the areas that perhaps could use changing.
So, are there any other disorders that can mimic depression?
So depression is a mood disorder, right? It's a disorder of your mood state. There are other mood disorders which present a little differently. I'm sure you've heard of bipolar disorder. So bipolar is essentially, it means that the disorder has two poles. One pole is depressive episodes, but the other pole is something called mania, which, to put it very simply, represents the exact opposite of depression, where the person is in a sustained state of happiness or excitement for no reason at all. And it doesn't go down, it doesn't come back to normal. And everything else that goes with it, high energy levels, being very talkative, very high self-esteem, almost to the point of feeling very grandiose, like I can do everything, I can do anything, I can achieve everything. And with no actual basis to these feelings or thoughts. And such high energy levels that they don't need sleep. They're extremely active. They don't feel tired. They can go into a state of overspending, overdoing things, things like that. So bipolar essentially is when your brain is not always able to regulate a state of normalcy in terms of mood. So sometimes the mood can dip or become low, out of control, and it's difficult to bring it back to normal. Sometimes the mood can just rise. You go into mania, and then the brain is not able to regulate it back to normalcy. So you stay in a sustained state of happiness, or it sounds good, but it's not actually, because again, there's dysfunction associated with this. But it's a little different from depression. It's treated very differently from depression, but we try to rule that out when somebody comes to us. Then there could be, states which look similar to depression, but they could be owing to a large amount of stress, and they are related to it. So as in, if I alleviate the stress, if I take away the thing that is stressing you out, or if it's time bound and it's gone, immediately your mood can just go back to being normal. Whereas in depression, while a stressor will precipitate it, whether you solve it for them or not, their mood has already shot beyond the limit of, or lower than normal. It doesn't come back on its own, even if you take away that factor. So that is the difference. Then, like I said, for elderly may not present with complaints of feeling low or sad or dull or flat. They might the family might say they are anxious all the time, they are jittery, they are agitated. So it can easily be mistaken for an anxiety disorder if you actually don't look into it in detail, right? And then sometimes, because part of depression's presentation is withdrawal and not being interested in anything, sometimes in elderly there could be things like cognitive issues. They are developing cognitive decline, the initial stages of which could look similar to depression, because you see them as being dull and withdrawn, not very interested in things. So we have to tease out the correct history, make a very detailed assessment before we actually commit to a diagnosis in certain cases.
Do depressed people go to work, drive car, go on trips,
Absolutely.
and all of that? Can they?
Absolutely.
Will they do it on their own?
On their own, maybe not. Maybe they require a lot of push. Maybe they are doing it out of social obligations. But well into moderate depression, people may actually be doing whatever is possible. They may be going to the office. Their functioning has come down, which means they're not as productive as before. They're not able to work as much. They're not able to, if they are students, study as much. The output is much less, but they are still continuing to do what they generally do. Right? So that can happen. It's only when it's very severe and it's very difficult to push yourself to do anything at all that you hit that stage.
Thank you so much, Dr. Aditi, for all the insights on depression. I really appreciate the kind of thoroughness and nuances with which you touched upon all the points on depression.
Thank you, Akshay.
All right. Thank you so much for joining me on this discussion about depression. In the next session, we will talk about a different topic on All About Health by AYOO. Live your best life.